Okay, so now we're going to go through the thinking behind an anterior cervical discectomy and fusion. Remember, anterior cervical means we're going from the front of the neck. Turns out to be a great approach. The discectomy part means we're going to be removing the arthritis that's bothering you, and the fusion part means we're going to tie the bones together after we get rid of that arthritis. So let's talk about the discectomy part. Remember, this is the front view of the bones of your spinal cord, and you've got this arthritis covering the anterior part of your disc. This is a side view, and this is all of this arthritis that got built up tying these bones together. This is the top-down view of the model. Remember, your spinal cord is back here, spinal cord right there, and this blue arthritis stuff is pushing on the nerves, pushing on the spinal cord. Here's the MR with the disc over here. Okay, so what do we do actually? Well, what we do actually is we come in from the front, we come in this way, right into that disc area, and then we, with a microscope and special instruments, we actually can remove the front part of this whole disc area, and then gradually work your way back, and gradually start moving and removing that disc stuff, the arthritis stuff that's pushing on the nerves and the spinal cord. So on your MR, again, we're coming in from the front, and then we're going to slowly remove all this disc material until we can get to the very back and sides. And once we get to the back and sides with the microscope and these special little bitty tiny delicate instruments, we can actually decompress, get rid of that stuff that's pushing on your nerves and pushing on your spinal cord. On the side view here, we're actually coming in this way and working our way back here, and then gradually, very carefully with the scope so you can see what you're doing, decompress that spinal cord, decompress those nerves, get rid of all this stuff right over here. And that is how you do your discectomy part of the operation. Okay, now for the fusion part of this operation. Remember, we've already done our discectomy. We've taken this blue arthritis stuff and removed it carefully with the microscope and those special instruments, and we've decompressed the spinal cord, and we've taken the pressure off of the nerves, and actually what you wind up doing is removing a bit of bone back here like that. So you have a nice big open space here. All right. Then what you do is, again, coming in from the front of the vertebral bodies, you put a little block of material right in that disc space you decompressed. Okay? And that little block of material is actually touching both of those bones, and what it's going to do is allow your normal bone to grow right through that thing, and eventually there's going to be a nice solid living connection of bone coming from the top bone to the bottom bone that's going to hold you together. This is all going to be one big block of solid living bone, and that's the fusion mass that you put in there. And then what you have to do is get sort of immediate stability. You want this whole thing to stay put. So there are a couple ways to do that. One way is actually just to toenail this mass in here with a couple of screws, one going up at 45 degrees, the other one going down at 45 degrees. That works pretty well. And then sometimes also what you can do, if you don't want to do that, is you can take a little metal plate, put it on the front of the bones, and just screw the plate into the top bone, screw the plate into the bottom bone, and that holds things together. So to recap, an anterior cervical discectomy and fusion is an operation that's done on the front of the neck. It removes arthritis, which is pushing on the nerves in the spinal cord, and finally it ties those bones back together. Okay, so the usual disclaimer: you watching this video does not make me your doctor. Use common sense. If it hurts when you do that, don't do that. And always keep in contact with your own healthcare provider throughout this. So we are all over the web. We have a very active Facebook page with our patients. We are big-time tweeters, and we are way into Instagram. To see more videos about anterior cervical discectomy surgery, general spine info, our blog, or to contact us, just hit us at drrodz.com.